Hello, today we're going to talk about managing stress effects. We'll be looking at the benefits of aerobic exercise, relaxation and meditation, and also the relationship between faith communities and health, or what some people refer to as the faith factor. So, as you know, aerobic exercise is any type of sustained activity that creates heart and lung fitness. It can include many different kinds of activities like jogging, swimming, biking, walking, various kinds of activities that are aerobic in nature. And it has been found that aerobic exercise helps to reduce depression and anxiety. And it can also help us to manage our weight more effectively and increase both the quality and the quantity of our life. Some researchers did an interesting study in which they compared relaxation, aerobic exercise, and no treatment in helping people who were depressed. And as you can see in this graph, those participants who engaged in aerobic exercise experienced the greatest improvement as measured by reduction in depression. Another type of activity that helps us to manage stress effects is the use of relaxation and meditation. Relaxation and meditation have been found to increase our sense of well-being and also to provide relief from both physical and psychological symptoms of stress like headaches, high blood pressure, anxiety, and insomnia. And in fact, it has been found that relaxation exercises may even help wounds to heal better, perhaps by helping to enhance the effectiveness of our immune system. There are many different ways of practicing relaxation. We might do it through yoga, through mindfulness meditation, through progressive muscle relaxation techniques, and various other approaches. I'm going to ask you to try one simple way of experiencing relaxation, which involves the use of mindfulness meditation right now. What I'm going to ask you to do in a moment is to close your eyes while you're in a comfortable position and focus on your breathing. You're breathing in and you're breathing out. And as you're focusing on your breathing, I'm going to ask you to observe any thoughts that come into your mind and just let them pass on through without focusing on them. Just acknowledge them and let them pass on through, and then bring your attention back to your breathing. So I'd like to ask you to get in that comfortable position now and just close your eyes. And with your eyes closed, to focus on your breathing in and your breathing out. And just pay attention to your breath, your life-giving breath, breathing in and breathing out. Any thoughts come into your mind, just acknowledge them, let them pass on through, and redirect your attention to your breathing. Now, if you have time, I'd like to ask you to pause the video and just keep your focus on your breathing for a while. You're breathing in and you're breathing out. Again, redirecting your thoughts, redirecting your attention to your breathing, and letting your thoughts just pass on by. Just acknowledge your thoughts, but don't focus on them. You're breathing in and you're breathing out. To do this for about 15 minutes, and when you're finished, just to open your eyes and hopefully you'll feel refreshed. And then to turn the video back on and we'll continue on with our discussion. An interesting study was done with people who had had heart attacks. And many of these people had type A personalities that we already have learned about. So with the folks who had heart attacks, they divided them into two groups. One group that just focused on medical treatment as usual, and the other group, in addition to medical treatment, also focused on lifestyle modifications, including doing things like learning relaxation methods and other stress management techniques and the use of exercise and that sort of thing. And as you can see, the percentage of patients with recurrent heart attacks was less for those in the lifestyle modification group compared with the group of patients who did not participate in lifestyle modification. Mindfulness meditation, which we just tried, is a method of meditation relaxation that many people find helpful. You can go on YouTube and find some really good demonstrations of mindfulness meditation that you can follow, including those done by Jon Kabat-Zinn. And I believe you have one of these in your video folder that you might try and see how you like it. But mindfulness meditation has helped people to decrease anxiety and depression, improve their sense of well-being. It seems to activate brain regions that are associated with more reflective awareness of self and surroundings, and to help us to remain calmer in situations where there may be emotional activation. There's an exciting area of research looking at the relationship between faith and health, and finding that people who are involved in religious communities and activities tend to be healthier, both physically and psychologically. They describe themselves as being more hopeful and grateful. They tend to engage in healthier behaviors, to be better connected with greater social support, to experience more positive emotions. And these activities together help them to have stronger immune system functioning and to even live longer. These studies are correlational in nature, so they don't actually prove cause and effect, but they do point to some very encouraging uh, outcomes for people who are religiously involved. We'll stop with that. And then our next topic, which we'll be looking at in our next slide video, is on happiness. Peace be with you.